Hello, and welcome to Caregivers of New Jersey's webinar, What is Self-Direction? This webinar is part of the series of the Self-Direction Academy's Family Networking and Learning Opportunities and Person-Centered Planning. My name is Trace Baxter, and I will be presenting today's web event. I'm the Assistant Director of Training and Quality Assurance for Caregivers of New Jersey, and I'm very excited to have you join me in today's presentation. As I mentioned earlier, this webinar is part of the Self-Direction Academy's Family Networking and Learning Opportunities and Person-Centered Planning. The Self-Direction Academy is a series of informational sessions taught by experienced professionals and designed to educate as well as empower individuals and their families in self-directed programs. Okay, let's start by reviewing today's webinar objectives. This webinar will define self-direction as it applies to the Community Care Waiver and the Comprehensive Waiver. Participants will be provided with an overview of the self-directed process, develop an understanding of the roles and responsibilities of everyone involved, and learn about the tools available to find desired services and resources. So what is self-direction? Simply put, self-direction is an approach which enables individuals with disabilities to have greater opportunities of choice and control over their supports and services. Self-direction ensures that individuals with disabilities have the means, responsibility, and authority to determine and implement, with the assistance of chosen family, friends, and professionals, the supports and services they need to be successful in the community. Some of these supports and services are ones that are part of systems, others are informal and generic and are just part of everyday living. Self-direction is about dreams. Everyone has dreams or ideas about what they want to do in their life. Our dreams for our lives show the things that we prefer or the choices we would make for how we want to live our lives. Dreams are about the things that we want to have happen, the people we want to be with, the places we want to go, and the way we want to spend our time. Dreams are about big things and small things. Dreams are about our choices for ourselves. Dreams are not one size fits all. Yet even the most independent of us rarely realizes a dream without the help of others. Just like each of us, individuals with disabilities can use the support of family, friends, and professionals in achieving their dreams. Using the individual's dreams, a person-centered plan can be built or constructed to guide the individual towards securing the supports and services they need to making their life more complete and meaningful. To give an example of how dreams play a role in self-direction, let me tell you a story about a young woman who wanted to live in her own home. To protect her privacy, I will call her Nancy. Nancy was born in Newark, New Jersey in May of 1970. Due to unfortunate family circumstances, Nancy was admitted to a developmental center in September 2000. During her years at the developmental center, Nancy developed a dream of living in her own apartment, a dream for what she knew she was entitled. In 2005, Nancy, along with two other adults, and with the assistance of New Jersey Protection and Advocacy, took a stand. They demanded their rights under a 1999 U.S. Supreme Court decree known as Olmstead. The decree stated that people with disabilities have the right to live in the least restricted place that meets their needs. To Nancy, least restricted did not mean living in a situation or under terms that were not of her own choosing. She did not want to live in an institution. She wanted to have a home of her own. She had the ability to live in a larger community, attend school, get a job, and be independent. Her stand would not be a short one, but her resolve ultimately paved the way for organizations like Caregivers of New Jersey to help her and other people like her realize their dreams. As a result of Nancy's dream, on May 2, 2007, the state of New Jersey began taking steps to help people with disabilities make a choice about remaining in an institutional setting or move out into the community. She officially moved out of North Jersey Developmental Center in Totowa on July 24, 2009. She now lives in her own home. Although she still has staff available to her 24 hours a day, those staff members are her staff. They exist solely and continue to help Nancy live out her dream. Nancy is her own success story. She reminds us why helping people like her achieve their dreams is so worthwhile. We stated that self-direction is about dreams, but what about fears and nightmares? Fears and nightmares can also play a role in self-direction, but in a different way. Identifying and acknowledging fears and nightmares can help determine what an individual doesn't want in their life, potential circumstances to avoid, and how to make good, healthy, safe choices. Choice is the freedom to direct one's life based on one's dreams and preferences. Self-direction ensures that individuals with disabilities have the freedom to live lives like everyone else. Individuals are no longer restricted to predetermined programs, but have the freedom to purchase options that naturally support the life of the individual. Here are some important choices. Choosing where to work and what to do is important, especially now that New Jersey has been declared an employment first state, which means that competitive employment in the general workforce is the first and preferred post-education outcome for people with any type of disability. Choosing how to spend one's free time is important. Nowadays there are so many things we can do, so many opportunities we can take advantage of, and so many possible ways we can spend our time. Choosing who we spend our time with is important. There is a saying, you are the average of the 5 people you spend the most time with. The people an individual spends time with can determine how they think, how they act, and ultimately how successful they will be. The list can go on and on. Some choices are important to us and others are important for us. Choices that are important to us often reflect our personal preference, while choices important for us may address health and safety concerns. Let's take a moment and talk about important to us and important for us. Through gathering information about an individual, we are able to learn what's important to them, what's important for them, and the balance between the two. This is the principle that underpins the achievement of person-centered change. What is important to an individual is what they say through their own words and behaviors about what really matters to them. What's important for an individual are the things that help them become or stay healthy and safe, whether it's important to them or not. The balance between the two is the compromise that all of us experience in life, between wanting to eat chocolate and maintain weight, and between having lazy evenings and wanting to get fitter at the gym. We all need to find a balance so that our lives are not just about what we choose, but also what we know needs to happen for us to be healthy and safe. Self-direction is about control. Individuals with disabilities have the authority and control over services, including spending, through self-direction. This creates financial accountability by individuals and recognizes their essential roles as consumers in planning, managing, and purchasing supports. Self-direction waivers provide authority over how to spend an agreed resource amount. The flow of funds increases the responsibility of individuals with disabilities to use funds wisely. Control also gives individuals the ability to maximize flexibility and creativity of supports, allowing adjustments when needed, so individuals with disabilities get what they need. If individuals with disabilities are making the decisions, then it is expected that self-direction will provide a good fit between the individual needs and required support. Flexibility also encourages non-traditional support, which can lead to new solutions to the national and statewide shortage of available workers. Individuals can determine the unique supports that work for them, identifying trusted friends, neighbors, family members, and providers to help plan, implement, and evaluate supports and services. Self-direction is about community. Self-direction supports individuals moving from dependence on programs to interdependence in the community by building on their gifts and talents. In the self-directed approach, individuals with disabilities, and if appropriate their families, take the lead in planning, implementing, and evaluating quality of life. Self-advocacy is important on the personal and systemic levels in self-direction. Confirmation of the central role of people with disabilities in determining the policies and processes that most affect their lives is a fundamental principle of self-direction. Through self-direction, public dollars are viewed as ongoing investment in the lives of people with disabilities. Individuals are expected to give back to society and contribute to their communities. In discussing self-direction, there have been some key words mentioned, and these key words are the guiding principles of self-direction for individuals and their families. Let's take a moment to identify and define those key words. Freedom. Freedom to live a meaningful life in the community and to plan and direct their own lives. Authority and control. Authority over their own lives, including the control of resources. Support. Support to organize resources in ways that are life-enhancing and meaningful, as well as opportunities for increased community participation. Responsibility. Responsibility for living in interdependent communities and for the wise use of public dollars to meet identified needs. Confirmation. Confirmation of the important leadership that self-advocates must hold in a newly designed system. How important is self-direction to people with disabilities? Individuals with disabilities, just like the rest of the population, come in all shapes and sizes. Some individuals with disabilities want to maintain total control over their lives and all of life's choices. Other individuals have particular dreams that are important to them. All individuals with disabilities have the same rights as all other Americans to express their choices and direct their own lives to the fullest extent they want. Now that we've defined self-direction, let's take a look at the self-directed process. The self-directed process is a team effort with the individual being the center of attention. The team is comprised of family and friends, staff, monitors, the support coordinator, mentors, and the fiscal agent. The team works together to assist the individual in realizing their dreams and choices. After doing so, a person-centered plan can be constructed to guide the individual towards securing the supports and services they need, making their life more complete and meaningful. I'm sure you've heard the saying, there is no I in team. However, in self-direction, there is an I in team. The I is for the individual, as they are the center of attention. Everything revolves around them. The team has to learn how an individual wants to live and then assist in what needs to be done to help the individual move towards that life. Let's define the roles of the team members in the self-directed process. Family and friends. Family and friends are the key members of the team. Family and friends can provide insight, support, and assistance as the individual selects the services that best meets her or his needs. Staff. Current and past staff can also play a key role as the member of the team. If a relationship is formed between the individual and staff, the staff are usually the ones that know the individual's hopes and dreams. Staff can provide clear direction of the individual's health needs and services that are needed to address healthcare concerns. Monitors. Monitors review the person-centered plan and the supports and services attached to it for completeness and compliance and provides the official approval. Monitors also ensure the development, implementation, annual review, and approval of the individual's annual service plan, and exercises a protective service function regarding the individual's health and safety. Support coordinators. The support coordinator assists the individual through the process of self-direction and empowers them to remain in charge of their plan. The support coordinator introduces the individual to the person-centered planning process, assists with accessing services and supports, and is responsible for providing information about the range of services and supports available both in advance of and during the planning meeting. Mentors. Mentors are individuals who have a disability or have a relative with a disability. Mentors are trained in all aspects of person-centered planning so they can support individuals to develop person-centered plans on a long-term basis. They also assist in the development and implementation of the plan by establishing a relationship with the individual through the sharing of their own real-life experiences. The fiscal agent. The fiscal agent is an agency which manages the business aspect of making payment, handles the payroll and taxes, and accounts for expenditures made on behalf of the individual. Also, the fiscal agent is considered the employer of record for tax benefit purposes. Now that we have defined the roles of the team members, let's talk about the actual self-directed process. Once the individual is approved for Medicaid or shows an active Medicaid status, the individual will be assigned a budget corresponding to the individual's level of need. Then a support coordinator will be assigned to assist the individual in the development of their person-centered plan. The plan is developed through a person-centered planning process that includes the assessment of the individual's needs, strengths, and preferences, build upon the individual's capacity to engage in activities and promote community life, respects the individual's preferences, choices, and abilities, and involves family and friends and professionals in the planning and delivery of services and supports as desired or required by the individual. Development of the plan drives the outcomes and services that will be put into place in order to ensure that meeting the best interests and needs of the individual is the primary focus. While the support coordinator is developing the plan, the individual starts researching and choosing the services that are individualized to their needs. The support coordinator can also assist with the research of services. The individual informs the support coordinator of the chosen services and provides the contact information of the providers that will be delivering the services, as well as the rate and schedule of delivery. The support coordinator will contact the provider to confirm and secure the services. Once the services have been confirmed and secured, the support coordinator completes and submits the plan of care, which includes the person-centered plan, supporting documentation, and attached services to the monitor for review. The monitor will review the plan, ensuring that the services fall within established guidelines and that any identified health and safety risks have been addressed, and responds to the support coordinator with an approval or a request for changes. Once the plan of care is approved, the support coordinator will contact the individual and provider to let them know services can start. No services should be started until the plan of care is approved. Otherwise, the cost of services will be charged to the individual, not the budget. Let me repeat that. No services should be started until the plan of care is approved. Otherwise, the cost of services will be charged to the individual, not the budget. Once services start, it is the individual's responsibility to take control and manage the services that are being delivered. The support coordinator is always available to facilitate between the individual and provider if needed. Quarterly face-to-face contact with the support coordinator is required for individuals living with an unpaid caregiver, including family. At least one of these meetings each year must be conducted where the individual lives. Monthly face-to-face contact with the support coordinator is required during the first year only for individuals living on their own. Revisions can easily be made to the plan of care as an individual's needs and outcomes change. There are no limitations on the number of revisions that can be made. At the request of the individual or representative, the support coordinator will make the revision to the plan of care and submit it for approval. Each revision made requires the individual's or their representative's signature. The plan of care is developed at least annually and is on a 12-month cycle. Prior to the end of the 12-month cycle, the support coordinator will need to meet with the individual to review the current plan and make any needed revisions. By participating in self-direction, the individual has greater control over the services they receive, how they receive them, and who provides them. With this control, an individual also has the responsibility of managing their services with the support of a team of professionals. Since self-direction depends on the active participation of the individual, as well as their team of supports, there can be some confusion regarding the roles and responsibilities. Caregivers of New Jersey would like to give an overview of the individual's roles and responsibilities. Self-direction depends on the active participation of the individual. The individual will need to be completely involved, especially in the first year. After the first year, the individual will still need to be involved. However, since the person-centered plan has been written and approved, revisions to the plan, reviewing and developing outcomes, and the modifying of services are the primary concern. Since the individual has opted to self-direct, they will be researching and choosing their own services. The individual will be contacting the agencies directly to inquire about the types of programming they offer and will determine whether it's a good fit for them. The individual has to negotiate. Contracted vendors have up to rates, meaning that while they have a maximum limit on how much they can charge, they can also work out a deal with the individual or family. They want the business, so talk with them to come up with a mutually agreeable price for services. The goal is to use the assigned budget as efficiently as possible so the individual will have the resources available to create a varied schedule of activities of their choosing. Also, proper pre-planning of expenses will prevent overages in the budget and will ensure the dollars will stretch for the entire year. The individual will have to continuously follow up with the agencies that are providing the services. The individual will also be required to sign off on monthly vouchers from the agency so they can get paid. Please note, before signing off on a voucher, verify that the service was delivered and note the date of delivery. If at any time the individual feels dissatisfied with the services they are receiving, they can decide to end those services. This feature of self-direction is what makes it so appealing. Individuals are no longer locked into programs and services that they are not happy with. The individual will be communicating any changes with the support coordinator, who will be your primary contact of your team of supports. Please make sure the support coordinator is contacted before starting a new service. It cannot be paid for out of the budget until it is approved by the Division of Developmental Disabilities. Entering and approving new services is a process and may take several days. If the individual starts attending a program or receives services before an approval, the individual will be responsible for the expenses. Let me repeat that. If the individual starts attending a program or receives services before an approval, the individual will be responsible for the expenses. Ongoing support. The individual will receive ongoing support from the support coordinator as well as the other members of their team. They are all willing to help guide the individual through the self-direction process and answer any questions. Resources and services. There are many resources for finding the services and supports that an individual may need. The primary resource the individual should use is their support coordinator. Support coordinators work on a daily basis with agencies that provide services throughout the state of New Jersey. The support coordinator can provide the individual with a list of qualified agencies that can be used to research the desired services. The list is constantly growing as more and more agencies are becoming qualified to provide services for individuals who are choosing to self-direct. Another resource the individual can use are the mentors. Don't forget that mentors are individuals with a disability or have a relative with a disability. They are most likely already using services that could be suggested or could recommend resources for finding services. In addition, the mentors could help the individual research for desired services. Information and referral agencies are common resources. Information and referral agencies are sometimes referred to as one-stop shops, as they may offer or link the individual with needed services by identifying their needs, finding the most appropriate services to meet their needs, and linking them to the most appropriate service providers. The Internet is a resource that most people use on a daily basis. Browsing the Internet can provide the individual with lots of services. However, the individual should keep in mind that not all agencies are qualified to provide services using the self-directed budget. If an individual finds an agency that is not qualified, then they should talk to their support coordinator about getting the agency qualified to provide the desired services. Conference, workshops, and expos are wonderful resources. By attending conferences, workshops, and expos, the individual can find out about current trends and new services available. Many times agencies are presenters at said venues and they discuss the services they have to offer. Most conferences, workshops, and especially expos also have areas that are designated to feature agencies and the services they would like to provide. Networking can be a valuable resource. Talking with other people who are utilizing services can be very beneficial. They can offer referrals and give opinions based off of personal experiences. Family and friends can be an overlooked resource. Reach out to family and friends and ask them if they are aware of any desired services. They may have heard of through conversations or seen in advertisement services that the individual is looking for. And this concludes our webinar, What is Self-Direction? I hope this presentation has provided you with a better understanding of self-direction. If you have any questions about self-direction or you would like more information about the services that Caregivers of New Jersey provides, please contact Caregivers of New Jersey at 877-265-6360. We will be glad to answer your questions or direct you to someone who can assist you. Thank you.